Welcome student. I am Mr. Abhijit Bambre, working as assistant professor at Gokhale Education Society's Arts, Commerce and Science College, Zohar. Today we are going to learn what is analgesic drugs and what is antipyretic drugs. Let's move. Analgesic. Analgesia is a Greek word meaning without pain. Analgesic are the selective central nervous system depressant which bring about insensitivity to pain without loss of consciousness. Analgesia is a Greek word meaning without pain, and analgesic drugs are selective central nervous system depressant which bring about insensitivity to pain without loss of consciousness. It means analgesic are drugs which are capable for relieving the pain without loss of consciousness. On the basis of analgesic potency and capability to develop dependence and tolerance, analgesic drugs are commonly divided into two classes. That is, first one narcotics and another non-narcotic analgesic. Narcotic analgesics are drugs that act strongly on central nervous system. It means it act on cerebrum, spinal cord and medulla, whereas non-narcotic analgesics act mildly on peripheral nervous system. Peripheral nervous system includes somatic and autonomic nerve. Narcotic analgesics are strong pain relievers as compared to non-narcotic analgesic. It's all about analgesic. Analgesia is a Greek word meaning without pain. Analgesics are drugs that are capable to relieving the pain without loss of consciousness. There are two types, narcotic and non-narcotic analgesic. Next, narcosis. What is narcosis? Is defined as unconsciousness produced by a drugs. It is defined as unconsciousness produced by a drug. Actually, narcosis is a state produced by a narcotic drugs. Narcosis is a state produced by a narcotic drugs. Narcotics are the drugs which produce abnormally deep sleep, which induce increased tolerance to pain, feeling of well-being. Next, narcotic analgesic cause respiratory depression and cerebral vasodilation in CNS. Excessive dose of narcotic cause ceasing of respiration, which result in death, are called as narcotic poisoning. Excessive dose of narcotics, it causes ceasing of respiration. Ceasing means discontinuous of respiration. Ceasing means stop or discontinuous respiration, ultimately result in death, called as narcotic poisoning. They can also cause excessive dose of narcotics. They can also cause constipation, vomiting, nausea, cardiovascular disturbance, mental clouding, change in mood and behavior of the person. Nausea is the sensation of an urge to vomit. Next, long-term administration of narcotics analgesic can produce tolerance, psychic and physical dependence called as addiction. Narcotics are drugs which are used in excessive or excessive dose of narcotic, they are habit forming. Next, antipyretic. An antipyretic is a drug which is responsible for lowering in temperature of human being or any animal having fever to a normal, but has no effect on normal temperature status. Antipyretics, those are drugs, they are used for lowering in temperature or they are useful for a fever. Actually, narcotics analgesic or analgesic drugs, they are classified into two types: narcotic analgesic and non-narcotic analgesic. Here, narcotic analgesics, they are obtained from opium alkaloid occurring narcotic analgesic. These alkaloids contain 25% of opium. Opium is dry milky extract of unripe seed of plants, that is Papaver somniferum. Seeds of Papaver somniferus. Actually, narcotic analgesics or alkaloid, these alkaloid are of two type of classes. One is phenanthrene and second one was benzyl isoquinolines. Example of phenanthrenes are morphine, codeine, thebaine, while example of benzyl isoquinolines are papaverine and noscapine. Narcotic analgesic generally obtained from opium plant, that is Papaver somniferum. Next, morphine is an example of phenanthrenes. Morphine, structure of morphine is an general structure, actually is an general structure for morphine, heroin, and codeine, where R and R dash is equal to H, that is structure for morphine. When R and R dash is equal to acetyl group is an structure of heroin, and where R is equal to CH3 group and R dash is equal to H is an structure for codeine. It is actually morphine, it is major constituent of opium, first isolated in 18th hundred and fifth. Structure consists of 5 rigid ring with phenanthrene moiety. Levorotatory form of morphine is responsible for the activity. It is colorless It is crystalline, bitter in taste. It is insoluble in water but soluble in alkali. It is a potent pain reliever which relieve all kind of pain caused by serious injury and migraine, etc. Morphine are phenanthrene, example of phenanthrene class of alkaloid. It is habit forming drugs. It is major constituent of opium. They are colorless, crystalline, bitter in taste, insoluble in water but soluble in alkali. They are potent drug or potent pain reliever during the serious injuries and migraine, etc. Next, non-narcotic analgesic. Example of non-narcotic analgesic. These are actually there are three derivative: salicylic acid derivative, second para-aminophenol derivatives, third one cyclohexanol derivatives. Those are drugs that are came from non-narcotic analgesic. These analgesic relieve pain without interacting with opioid receptor. They possess anti-inflammatory activity. Therefore, they are also called as non-steroidal anti-inflammatory drugs. Thus, these drugs also produce antipyretic effect. Antipyretics means lowering in temperature, or they are useful for a fever. Example are salicylic acid derivative, then para-aminophenol derivative, cyclohexanol derivative. Next, aspirin. Aspirin, it is a white crystalline powder. Actually, aspirin is an example of salicylic acid derivatives. Salicylic acid cannot be used as as antipyretic or analgesic. Actually, salicylic acid cannot directly use as antipyretic or analgesic due to its toxicity. Therefore, some modification take place such as esterification at carboxylic group, alkylation of hydroxyl group, and introduction of some other group on phenyl ring are suggested to increase its activity and reduce toxicity of salicylic acid. Aspirin is a good example of such a derivative. Aspirin are also called as acetyl salicylic acid. It is white crystalline powder, slightly soluble in water but completely soluble in alcohol, ether, etc. It is moisture sensitive. Aspirin used as antipyretic, anti-inflammatory agent as well as analgesic. It is used to treat headache, discomfort, fever associated with cold, muscular pain, etc. Structure of aspirin. Aspirin is example of salicylic acid derivative. Next, paracetamol. Paracetamol is an example of para-aminophenol derivatives. These are known as possess, or these are known to possess antipyretic activity, means lowering in temperature. Among of ortho, meta and para derivatives, para substitute derivative are found to be significantly active with least toxicity. Ortho, meta and para derivatives, they are also gives antipyretic activity, but among of ortho, meta and para substituted derivatives having minimum toxicity. Paracetamol, it is an antipyretic and analgesic activity. It also used in arthritic and rheumatic pains. Arthritics means any disorder that affect a joint. Actually, symptoms generally induce joint pain and stiffness. Arthritis is an any disorder that affect the joint. It is useful for aspirin sensitive patient. Next, cyclohexanol derivatives. Example, tramadol. Cyclohexanol derivatives, example, tramadol. These are recently developed analgesic drugs containing cyclohexanol ring in their structure. Actually is an example of cyclohexanine derivative. Tramadol is an example of an cyclohexanol derivatives. They produce similar analgesic action as opiates. It is formed as a mixture of cis and trans isomer. The trans isomer actually has analgesic action. Trans isomer shows analgesic action. It is synthetic analog of codeine. It is used in severe physical pain, trauma, post-operative pain. Post-operative means after the surgery. Analgesic are used after the surgery. And pre-operative means before the surgery, and post means those drugs are used after the surgery. Post means after, and pre-operative painkiller means before the surgery. It's all about analgesic and antipyretic. Analgesics, analgesia, it came from Greek word. It means without pain. Or analgesic, those are drugs which are capable to relieving pain without loss of consciousness. Then term narcosis. Narcosis is a state produced by a narcotic drugs. Then narcotic drugs are two type: narcotic analgesic and non-narcotic analgesic. Then non-narcotic analgesics having those are drugs, they are relieve pain without interacting with the opioid receptor. They also having anti-inflammatory activity. Salicylic acid derivative, example aspirin. Para-aminophenol derivative, example paracetamol. And last one, cyclohexanol derivative, example tramadol. It's all about analgesic and antipyretic drugs.